myself Dr. Prachi Rathore, working as a medical officer in India's first comprehensive transgender clinic, Mitr clinic, which is located in Hyderabad. Current treatment for transgenders has been great. There is a great increase in treatment, I can say, compared to last decade, because after passing of our transgender bill, what we call that, every doctors are coming to know what exactly LGBTQ is and what are their problems. Previously, it won't be in that situation, because doctors used to refuse transgender patients because of what we call that fear. Definitely there will be a fear factor for every doctor, that if I treat a transgender and what if anything goes wrong, then definitely they'll call a group of people, and definitely there will be a mob on my hospitals and all these things. But situations has been changed now. They are coming to know what LGBTQ is, what are transgenders, and by talking to them, by giving some time to them, definitely they are adding our community in their practices also. Previously, due to lack of knowledge or due to lack of doctors, we transgenders used to go to quacks for our transition process. But right now, we can see that in India, there are many doctors who are supporting our transition process, and they are doing it legally. So definitely there is a lot of change. And previously, while doing transition in huts by the quacks, we used to face a lot of complications like urethral strictures, urinary tract infections. Most of the transgenders used to get common complaint like not able to urinate themselves and all. So definitely now the things are changed, and plastic surgeons are conducting all these surgeries. So I can only say list of complications has been reduced in our life. I can share my one of the personal experience here. In 2018, I went to a hospital because I got viral pneumonia at that time. So I don't know where to go. Actually, in hospitals, what exactly happened is like there will be a male line, male OPD and female OPD. But for us, for transgenders, there won't be a separate line. If we go in a female and stand in a female line, then definitely there will be kind of discrimination will be there. And we can't go and stand in a male line also. So the ideology of Mitr clinic started from there itself. Our director, Ms. Simran Barucha, has a plan of this Mitr clinic for our transgenders, and she actually implemented this at the year 2019. Clinic has established on January 29th, 2019 with the help of Accelerate and huge support of USAID and PEPFAR. The main idea and ideology behind starting Mitr clinic is, like for transition process, we have to travel each and every department. First, we have to go for psychiatrists. We have to get our gender identity certificates. Then we have to go to endocrinologists for our gender affirming hormonal therapies. Then we have to travel plastic surgeons or general surgeons for our transition process. And we have to consult physicians for our post-operative complications and all these things. By creating this clinic, Mitr clinic, we actually had a thought of combining all the departments in one roof. By that, there will be a medical officer who can assist them legally, who can work on their mental health status, and also by guiding them we have to go this transition process in a legal way by what we call that, by consulting psychiatrists, endocrinologists, plastic surgeon and all these things. Not only health, but we are also providing what we call that transgender portal identity cards for our community, affidavits, and exactly we are also looking the crisis part of our community also. The main interesting fact of this clinic is we have all transgender staffs, and our patients are definitely transgenders and patients from LGBT community. So the main point for starting up this clinic is this clinic will be a discrimination free for them. People can come without any fear here. And people also can think that this clinic is of my community, so I can easily avail services here without any fear, and I won't face any kind of discrimination here. So it is quite interesting. Second thing, like not only about transitions and all, we also do care of their personal health. Like you know very well that about transgenders who work as sex workers and all. So we also diagnose and treat like STIs, and we also keep patients who are seropositive, I mean HIV positive patients on their ART. We link up their ART centers and we make sure that adherence level should be good. Mitr Clinic is the only clinic which has been designed for transgenders. It is exclusively for transgenders. It has been established on January 29th, 2019, and initially we started with a single branch in Hyderabad, but right now we have 5 branches all over India, which is in Rangareddy, Pune, Thane, Lucknow. It is good that we have established a clinic for transgenders, but still we are facing a lot of discrimination. It is good that people come there, like they feel their clinic as their own house, because they won't face any kind of discrimination there. They won't face any kind of humiliation and assaults. So what if once they step out of the clinic? Definitely, being a doctor, I can only share my personal experience here. See, I'm a doctor and I'm a trans woman, so definitely I feel very good and proud to be a part of this clinic. But once I step out of this clinic, definitely society won't treat me as a doctor, right? They will have their what we call that, their perception towards transgender never change. So definitely this has to be changed, and I can say like see, there is around 20,000 population of transgenders in Hyderabad alone. So only Mitr Clinic is not sufficient. Definitely legislative changes has to be done by the government. They have to implement these kind of clinics from primary health sector to tertiary levels, and also sensitize each and every doctors regarding transgender health issues. They have to conduct sensitization programs and make at least a discriminatory what we call discrimination free hospitals. By that, at least 5 out of 10 transgenders will avail services from their hospitals also. The government has to be sensitized. I mean, they have to sensitize public sector regarding transgenders and their health issues also. By that, at least from the society, not about physical things, at least they might need psychological support from them. And definitely navigation of these changes, we have to push the government, and we have to be back of them to make sure that all these changes have to be implemented as soon as possible. And also public awareness has to be made by, see, we are like very much in trend of social media these days. So definitely like we have to conduct interviews, sensitization programs, and we have to go to the ground level of transgender community. We have to record their problems and we have to show to the public. By that, at least they'll feel that no, not every transgender is like arrogant. Not every transgender is coming for begging on streets and all these things. They are educated. They are transgender doctors, lawyers, what we call that, teachers, lecturers. So these has to be like this initiative has to be taken by the government itself, and they have to sensitize the public also, society. According to health perspective, I can only say that physical infrastructure, there should be a separate OP for transgenders, like there should be a separate line for transgenders. There should be gender neutral toilets in each and every hospitals. There should be a separate ward for transgenders. By that, at least they won't face any kind of discrimination there. So these changes makes a lot difference in transgenders' life.